Picture this. You're curled up on the couch on a quiet evening, your cat tucked warm and purring right against your side, and everything feels perfect. Then one morning, something is just a little off. Your cat doesn't come to the food bowl the way she always does. She's hiding in the back of the closet. Her coat looks a bit dull, a little rough. And in the back of your mind, that quiet dread starts to rise. You think, how long has this been going on? You think, what did I miss? You run through everything you've been doing. The food, the treats, the water bowl in the corner, the twice yearly vet visits, and you can't find it. You think you've been doing everything right. That's the moment I want to talk to you about today. Because the truth is, some of the things that are quietly shortening your cat's life aren't the obvious ones. They're not neglect. They're not cruelty. They're the small, everyday habits, the things you do out of love, out of routine, out of simply not knowing any better, that accumulate over months and years and quietly, invisibly chip away at the time you have together. But what if I told you that by the end of this video, you'd know exactly what those 7 things are, and you'd have a clear, simple, completely natural path forward to add years, real years, to your cat's life? That's not a promise I make lightly, but it's a promise I can keep. The answers aren't hidden behind an expensive specialist or a complicated drug protocol. They're hiding in plain sight, in your daily routine, in your kitchen pantry, in choices you make without even thinking about them right now. After today, you'll think about them differently. Welcome back to the channel, everyone. I'm James Pohl, your neighborhood veterinarian, and it means a great deal to me that you keep coming back. After 38 years in clinical practice, I have seen somewhere in the neighborhood of 22,000 cats come through my exam rooms. That's a lifetime of watching families grieve too soon, watching cats leave years before they should have. And I can tell you honestly, looking back across all those decades, the same patterns come up again and again. Not complicated diagnoses, not exotic diseases, simple, correctable habits that nobody warned those owners about, because conventional medicine tends to focus on treating what's already broken rather than protecting what's still working. That's where my thinking changed about 15 years into my career. I started asking a different question. Not what do I treat, but what caused this in the first place? And the answers almost always pointed back to the home, to the daily routine, to the slow, quiet damage we accidentally do to the animals we love most. So that's what I want to walk you through today, my friends. 7 specific things, 7 common everyday habits and oversights that are silently working against your cat's longevity. Some of them will surprise you. Some of them might make you feel a little uncomfortable because you'll recognize yourself in them. That's okay. That's exactly why we're here. Now, I know many of you have been with this community for a while, and I want to say the warmth and the love in this comment section is something genuinely special. If you're new here, welcome. You might also want to go back and watch my earlier video on the one ingredient that transforms your cat's kidney function. It ties in beautifully with what we're covering today, and your cat will thank you for both. Here is what we're covering. We're going to go deep into each of these 7 habits, one at a time. I'm going to explain the exact biology of why each one causes harm. I'm going to give you a concrete, practical replacement, something you can do starting today. And at the end, I'm going to tie it all together into one simple framework you can actually follow without feeling overwhelmed. Grab a notebook if you've got one nearby. And if you haven't subscribed yet, please do it now before we go any further, because this is the kind of video the algorithm doesn't always push to the right people, and your subscription helps this safe, honest, holistic veterinary advice reach the families who need it most. All right, let's get into it. Mistake number 1. You're giving your cat a bowl of dry kibble every single day and calling it a complete diet? I know how that sounds. Dry food is convenient. It's what the bag says. It's what the vet at the clinic down the street probably told you to use. And look, I'm not here to make anyone feel guilty for following the conventional advice. But after 38 years, I have to be honest with you. Cats are obligate carnivores. That's not a preference. It's a biological fact. Their bodies are built to extract hydration from raw, fresh prey. In the wild, a mouse is about 70% water. A bag of dry kibble is about 10% water. That gap, that 60% gap in hydration, is silently driving a slow chronic dehydration in your cat's kidneys day after day, year after year. The kidney is the organ most likely to fail in a domestic cat. Chronic kidney disease is the number one killer of cats over the age of 10. And most veterinary researchers now agree that decades of low moisture diets are a primary contributing factor. The compound to understand here is antidiuretic hormone. When your cat's body senses insufficient water intake, it signals the kidneys to concentrate urine more and more aggressively, pulling as much fluid back into the body as possible. This creates urine so concentrated, it begins to damage the delicate filtration membranes inside the kidney, the glomeruli. Over time, those membranes scar, they lose function. And by the time you see the clinical signs, the weight loss, the hiding, the increased thirst that arrives too late, your cat may have already lost 60 to 70% of kidney function. The fix is elegantly simple. Start transitioning your cat to a high-quality wet food as the primary meal, not as a treat, as the foundation. If your cat resists, and some cats are deeply stubborn about texture changes, add a tablespoon of low-sodium chicken or bone broth, warm, not hot, to the wet food. The scent triggers eating behavior. Do it gradually, mixing roughly a quarter wet food with 3/4 dry for the first week, then half and half the second week, then 3/4 wet by the third. Give the gut time to adjust. And if your cat will tolerate it, a fresh water fountain, the kind with a gentle moving current, increases water intake in cats by up to 30% compared to a static bowl, because cats are instinctively drawn to moving water. It mimics a stream. It's written into their DNA. One important warning before we move on. If your cat already has a diagnosed kidney condition, do not dramatically change the protein level in their food without speaking to your vet first. Some late-stage kidney cases require a specific phosphorus-restricted diet, and well-meaning owners have accidentally caused harm by switching to a higher protein wet food at the wrong stage. When in doubt, get blood work done first. That's not me being overcautious, that's me being your vet. Mistake number 2, you're ignoring your cat's mouth. If I had one conversation I wish I could have had with every cat owner I've ever seen, it would be this one. Dental disease in cats is silent, it's slow, and it is devastating. Studies from veterinary dental specialists now estimate that by age 3, somewhere between 70 and 80% of cats already have some form of periodontal disease. By age 6, that number climbs higher. Still, here's the mechanism. The mouth is not isolated from the rest of the body. The tissues under the gum line are richly supplied with blood vessels. When a bacterial biofilm, which is what dental plaque actually is, establishes itself below the gum line, those bacteria secrete toxins and inflammatory compounds directly into the bloodstream every time your cat chews, every single meal. Those circulating inflammatory agents, including a family of compounds called lipopolysaccharides from gram-negative bacteria, put a continuous stress load on the heart valves, the kidneys, and the liver. Cats with untreated dental disease are statistically more likely to develop cardiomyopathy and chronic kidney disease. The connection isn't coincidental, it's biological. Now, I'm not going to tell you to brush your cat's teeth every day, because most cats, if we are being honest, will not allow that without a fight that makes the whole thing unsustainable. What I am going to tell you is this. Get a small piece of gauze, wrap it around your fingertip, and once or twice a week, gently rub it along the outer surface of your cat's back upper teeth where the gum line meets the tooth. Use no product at all at first. Just the friction. You're disrupting the biofilm before it mineralizes into tartar. Once your cat tolerates it, which usually takes 2 to 3 weeks of gentle, patient daily handling, you can add a tiny amount of a pet-safe enzymatic gel about the size of a grain of rice, which contains the compound glucose oxidase, and it breaks down bacterial cell walls without any rinsing needed. At home, raw chicken necks. given under supervision once or twice a week for cats large enough to handle them, provide natural, mechanical abrasion that mirrors what wild cats get from prey. They are not a substitute for professional dental cleanings, but they are a meaningful supplement that slows accumulation. The hard warning here: if your cat already has visible tartar buildup, inflamed gums, drooling, dropping food, or a change in eating behavior, please don't try to manage that at home. Those are signs of established disease that needs a professional cleaning under anesthesia and possibly extractions. Home care is prevention and maintenance, not treatment. Mistake number 3. You're letting your cat live in a state of chronic, unaddressed stress. This one surprises people because cats look so calm most of the time. They sleep 16 hours a day. How stressed can they be? But cats are, at their neurological core, both predator and prey, and their nervous systems reflect that paradox. They are wired for vigilance. They are wired to scan constantly for threat. And in a modern home, there are stressors that we are completely blind to because they're part of our normal. The scent of a neighbor's dog drifting under the front door, the unpredictable schedule of a household with young children, another cat in the home whose territory boundaries aren't clearly defined, even a litter box placed in a high-traffic area that makes your cat feel vulnerable in the moment of elimination. Chronic low-grade stress in cats drives sustained elevation of cortisol, the primary stress hormone. Elevated cortisol suppresses the immune system, specifically the cellular arm of immunity that kills viruses and cancerous cells before they establish. It disrupts the intestinal epithelial lining, contributing to what researchers now call leaky gut syndrome, where inflammatory molecules cross from the intestinal lumen into systemic circulation. Chronically stressed cats are significantly more likely to develop idiopathic cystitis, the painful bladder inflammation that has no bacterial cause, because the bladder wall in cats has direct neural sensitivity to psychological stress through the hypothalamic pituitary adrenal axis. The fix here is environmental, and it doesn't cost much. First, create at least 2 high, safe vertical perches where your cat can survey the room from above. Height equals safety for a cat. It's not a preference, it's a psychological need. Second, feed multiple cats from separate bowls in separate areas of the house and have 1 litter box per cat plus 1 additional. Third, for cats with persistent stress signs like overgrooming, hiding, or recurrent cystitis episodes, consider a synthetic feline facial pheromone diffuser. The active analog is a pheromone. Cats deposit naturally when they rub their cheeks on objects to mark safety. Clinical trials show it reduces stress markers in cats within 2 weeks. And here is the home remedy that most people overlook entirely. Lavender, a single drop of high-quality, pure lavender essential oil, diluted in about 30 milliliters of a carrier oil, like fractionated coconut oil, and dabbed on a cloth near, not on, your cat's sleeping area has been shown to reduce anxiety-linked behaviors. The compound linalool modulates the GABA receptor, the same calming pathway that certain anti-anxiety medications work on. But I need to say this carefully. Pure, undiluted essential oils placed directly on a cat's skin or coat can cause liver toxicity because cats lack the liver enzyme glucuronosyl transferase that processes many aromatic compounds. Diffused at low concentration in a well-ventilated room, with the cat able to leave at any time, it's safe and effective. Applied directly, it is potentially dangerous. Please respect that line. Stay right here with me, because the next 3 mistakes are the ones I almost never see discussed anywhere else, and they may be the most important of all. Mistake number 4, you're using the wrong cleaning products in your home. I want you to go under your kitchen sink right now and look at the labels on your cleaning products. If you see the word pine, or if you see the word phenol, or if you see tea tree oil listed as a fragrance ingredient, those products represent a genuine, serious hazard to your cat. Cats are uniquely susceptible to phenolic compounds and certain terpene derivatives because they are deficient in the enzyme pathway, specifically hepatic glucuronidation that metabolizes and detoxifies these compounds. In most other mammals, including dogs and humans, phenol buildup in a cat system causes oxidative damage to red blood cells, a condition called methemoglobinemia, and progressive liver failure. The onset is subtle: lethargy, a faint chemical smell on the coat, pale or brownish gums. The safer replacements are things you almost certainly already have. White distilled vinegar, diluted 50% with water, is a highly effective surface sanitizer against common household bacteria and mold. The acetic acid disrupts bacterial cell membranes without leaving a residue that your cat will walk through and then lick from her paws. For tougher cleaning jobs, a paste of baking soda and a small amount of Castile soap, which is made from plant-based saponins, cuts through grease and grime without phenolic residue. And always let surfaces dry fully before allowing your cat back into the area, even with safe cleaners, to minimize ingestion of any residue. Mistake number 5. You're not moving your cat's body. Indoor cats by the age of 6 or 7 often show early signs of what in human medicine we'd call metabolic syndrome. Excess fat accumulation, especially around the visceral organs. Low-grade systemic inflammation driven by adipokines, the inflammatory molecules secreted by fat tissue itself, insulin sensitivity changes, and, crucially, muscle mass loss, a condition called sarcopenia, which accelerates aging in every organ system. The fix isn't just about calories. It's about activating the hunting sequence. Cats need to stalk, pounce, capture, and bite. That's the full behavioral loop. A food puzzle that makes your cat work for a portion of her daily meal triggers that full sequence, keeps her mind sharp, and burns energy in a hormonally healthy way. Interactive play with a wand toy, 10 to 15 minutes twice a day, raises heart rate to a training zone, releases endorphins, and maintains fast twitch muscle fiber mass. Here's a powerful and almost completely overlooked home intervention: raw ginger. A pinch, and I mean truly a pinch, about 1/16 of a teaspoon of freshly grated ginger added to your cat's wet food 2 or 3 times per week, stimulates gastric motility, reduces systemic inflammation through the compound gingerol, which inhibits the COX-2 inflammatory enzyme pathway and supports joint health in older cats. Start with even less if your cat is small. Ginger is warming and potent. Too much can cause stomach upset. Think of it as a spice, not a supplement. And one firm warning: do not give your cat ginger if she is on blood-thinning medication or scheduled for surgery, because gingerol has a mild antiplatelet effect. Always mention it to your vet at the next visit. Mistake number 6. You're skipping regular at-home physical checks. Your vet sees your cat once, maybe twice a year. That leaves 363 days where you are the only set of eyes and hands on your cat's body. And most of the time, we use those days without any system at all. We pet our cats, we play with them, but we don't look, we don't feel, we don't compare. I want to teach you a simple, once a week, 5-minute scan. Start at the head. Part the fur just above the ears and look for small, firm bumps, which can indicate cyst development or early mast cell activity. Run your fingers along the jaw and down the neck, feeling the lymph nodes just under the angle of the jaw. They should feel like tiny soft peas. If they feel hard, enlarged, or if you can feel more than one, that's worth noting. Move to the belly. Lay your cat on her side gently, and with flat fingers, not fingertips, palpate the abdomen with the lightest possible pressure. You're not pushing in. You're feeling the surface. Asymmetry, a firm mass, a tense response, any of those are reasons to call your vet. Check the gums every week. Healthy cat gums are a pink salmon color, and when you press them with a fingertip and release, the color should return in under 2 seconds. That's called the capillary refill time. Pale, white, yellow, or blue-tinged gums are emergencies. No exceptions. Mistake number 7. You're treating your cat like a small, indoor-only thing that doesn't need mental engagement with the outside world. Cats are sensory creatures. Their olfactory bulb, relative to brain size, is roughly twice as large as ours. The portion of their brain dedicated to processing movement and visual change is extraordinary. An indoor cat who never experiences fresh air, novel scent, Unfiltered natural light or the sight of birds and insects will, over months and years, develop a low-level apathy and behavioral dullness that weakens her engagement with life. It's not depression in the human sense, but the neurobiology is parallel. Low environmental enrichment correlates with decreased dopaminergic activity in the prefrontal cortex and basal ganglia of domestic cats, according to feline behavioral research from the University of California. Dopamine, the molecule of motivation and anticipatory pleasure, declines, and with it, the cat's drive to move, to eat with enthusiasm, to play, to groom. The solution is surprisingly accessible. A window bird feeder placed directly against the glass of a window your cat can comfortably sit at is one of the highest impact, lowest cost enrichment tools available. The visual and auditory stimulation of birds activates the prey detection circuit, flooding the cat's brain with dopamine and norepinephrine twice a day. A small patch of cat-safe herbs in a pot on a sunny windowsill, silver vine, valerian root, or catmint, which all trigger a response similar to but distinct from catnip through the compound nipetolactol, provides olfactory novelty that refreshes the sensory system. And if you have the means, a safely enclosed outdoor cat patio, sometimes called a catio, even a very small one, attached to a window, provides exposure to full-spectrum natural light, which regulates melatonin and circadian rhythm more effectively than any indoor lighting and supports immune function through vitamin D photosynthesis in the skin. Now, I want to address something I hear a lot. But James, isn't all of this a bit overwhelming? Where am I supposed to start? My friend, I hear you. And I want you to take a breath because this is not meant to make you feel like you've been doing everything wrong. You have been doing your best. Every single one of you watching this, what I want you to do is this. Pick just two of these 7 mistakes, the 2 that felt most familiar to you, the 2 where you thought, yes, that's me, that's my house, that's my cat. Start there. Make those 2 changes this week. Let them become habit. Then come back to this video in a month and pick 2 more. That's it. That's the whole system. Don't try to revolutionize your cat's entire life in one weekend. The stomach gets upset, the cat gets overwhelmed, the human gets burned out and reverts to old habits. Slow, sustained change compounded over months is what saves lives. Not a dramatic overhaul that lasts 3 days. And the golden rule that ties all 7 together is this. Work with your cat's biology, not against it. She is an obligate carnivore who needs moisture-rich food. She is a predator-prey animal who needs to feel both safe and stimulated. She is a creature with a liver that processes the world differently than yours does. Respect those differences, and she will almost certainly give you more years. Now I need to be honest with you about when home care isn't enough. If your cat is losing weight without explanation, if she's drinking unusually large amounts of water, if she's urinating outside the litter box and it's a new behavior, if you notice any lump that wasn't there last month, if her gums are pale or yellow, if she's crying when she uses the litter box, if she's breathing with her mouth open, these are not watch and wait situations. These are call your vet today situations. The remedies and habits we talked about today are prevention. They are the daily care that keeps a healthy cat healthy. They are not a substitute for professional diagnosis when something is genuinely wrong. Please, please know that line. The role of a good home caregiver is exactly like the role of a good human who eats well, sleeps well, and moves their body. It drastically reduces the odds of getting sick, but it doesn't mean you never need a doctor. It means when you do need one, things tend to go better because the foundation was strong. I want to close today by talking directly to you, not to cat owners in general, to you specifically. The fact that you just spent this time learning about your cat's health, that you stayed all the way through, that you took notes or paused to think or nodded when something resonated, that tells me everything about who you are. You are not a passive pet owner. You are the person who takes this seriously. You are the person your cat chose. And cats, as any veteran veterinarian will tell you, do choose. They are not obligated to love. When a cat chooses you, it means something real. The years you give your cat by changing these habits, they're not just added time, they're more evenings on that couch, more mornings with that warm weight against your legs, more of that absurd, beautiful purring that rewires the human nervous system at about 25 hertz, which researchers believe actually reduces cortisol and blood pressure in the owner. Your cat heals you too. Take care of her, and she will keep doing that for as long as possible. If this video helped you, please give it a like right now. Not for me, but because when you do, you're telling the algorithm that this kind of safe, honest, holistic veterinary content is valuable, and you're helping it reach another cat parent who needs it just as much as you did today. Subscribe if you haven't, because I have so much more to share with you, and I don't want you to miss what's coming next. And leave me a comment below answering this question. Which of these 7 mistakes was the biggest surprise for you? The one you didn't see coming? I read every single one, and I genuinely want to know. Until next time, my friends, give that sweet cat of yours a gentle scratch behind the ears tonight from me. Stay safe out there, trust your instincts, and never stop showing up